Hey, it's Dr. Josh here, and if you're watching this episode, I want to first say thank you, and second of all, this episode is really important to me because I'm going to share with you the top 10 things I've learned as a result of practicing for 10 years. So this is my 10-year anniversary in chiropractic practice and in the health and wellness space. So I'm going to share with you the top 10 things that I have learned over the last 10 years. The first thing is to avoid trauma. This is very much seen in the chiropractic field when it comes to surgeries, when it comes to some sort of trauma or injury. But the best way to live a healthier life is to avoid trauma. And this could be all types of trauma. But trauma, what it does really, it subjects your body to an additional mental and physical stress that really delays your body of healing. So if you can avoid trauma, you can really allow yourself to live a better, healthier life. The most common thing that people come in stating in my office is that they don't stretch enough or they don't have good flexibility. As a result of that, most people blame a lack of flexibility on their injuries. The truth is that you need not only flexibility, but you need mobility and you need strength training. Most people literally just jump straight to flexibility, and research has shown over and over again that that is not the best way to get over injuries. The best way is through strength training. So most of the time when you flip it around, it really shows that most patients are actually doing some of the things that are not getting themselves better more so than they are. So don't focus entirely on flexibility for your injuries. Focus a little bit on all of them, but strength training is the best way to get out of injury and to prevent injury. A diagnosis is just a terminology that we use in the medical field. It really literally gives you a name and a description of what the problem is. A diagnosis by definition is a problem, right? So as a result of a problem, a lot of patients label themselves, they define themselves as a result of my disc herniation, my low back pain, my sciatica, whatever it may be. But at the end of the day, a diagnosis is just a term and it does not define you. Just because you've been labeled with a term does not mean that you have to suffer the same way all the other people under that term have. So at the end of the day, a diagnosis is just a terminology and it does not define you, nor does it set your prognosis or what your recovery looks like. It doesn't mean that you can't get back to a healthy, happy life. It's just a terminology that we use in the medical world to define something, and it does not define you. It's not your bed or pillow. I cannot tell you how many times patients come in and say, I think I slept wrong, or I think it's my bed, I think it's my pillow. In the 10 years that I have been a chiropractor, I have never seen a bed or a pillow fix anyone at all. So if you are relying on a $3,000 bed or a $1,500 pillow, whatever it is, and I've seen that happen before, you're wrong. It's not likely the problem. What is probably the issue is your lack of movement, your lack of awareness. Now, beds and pillows can significantly impact it. However, I do recommend a high quality bed, but if you are buying a bed to fix your problem, it's probably not going to work, because I've never seen that happen in the course of 10 years. So it can definitely soothe you, it can definitely help, but it's not going to fix it. We as humans all need to be heard, loved, and appreciated. Now, I think this is very common knowledge, but in the medical world, it's not practiced nearly enough. Yet we as practitioners all go into the same field to help people, but yet we don't listen to them. Listening, appreciating, and loving our fellow humans is really one of the arts and the things that make us human, so that we can understand and help others. So if you're really just looking to help somebody, some of the basic, most easy things to do is just to listen to them. Tell them that you understand what's going on, appreciate them, and really love them as a human and who they are, and meet them where we're at. I can't tell you how many times patients will come into me and say, my doctor told me to lose weight, my doctor said this, my doctor said that, and they didn't even listen to the patient's real problems. So at the end of the day, we all need to do this. We all need to sit down, slow it down, understand the patient, understand you. You need to understand us, and we need to understand you so that we can take the best steps moving forward. Just doing this, slowing down and understanding human nature, is going to allow you to heal better, feel better, and understand the route that you need to take that is best for you. The truth is, people do change. That age-old saying that people don't change is absolutely false. I've seen patients lose 100 pounds. I've seen people have so many sciatica surgeries and get back to a normal life. I've seen people change their habits. I have seen people change their personalities. And if you're sitting here watching this right now, I ask you to think about who you were 10 years ago, 7 years ago, 15 years ago, or 20 years ago. And I really want you to say, are you that same person? Yes, maybe some of your habits are the same, both good or bad. Some of them may be the same, but the truth is people do change. People do get out of pain. People do improve their life, and you can change too. So we are always evolving as humans. We are always evolving on the health and spectrum. So you can change your life, you can change your habits, you can change so much. And I have seen patients change, and it really does make a difference. So if you think that age-old saying is people never change is true, I really would ask you to consider, are you changing? Are you looking to evolve? Are you looking to make a change? Because at the end of the day, I do believe that humans and yourself can make a change. There are only 3 phases of care, okay? That's the relief phase, meaning when you're in pain, we're trying to help you get out of pain. There is a corrective phase where we try to correct and place a scaffolding over that injury that you're currently having. And then finally, there's the training and performance phase, really. So that's when you're kind of almost back healed, or you're practically healed up, and you're kind of training, and it looks like a gym phase. Now, the problem is that most people go from I have pain to then they get out of pain, and then they go right back to their normal activities, and they skip over the corrective phase. The truth is, most people need to spend the majority of their time correcting their problem, improving their posture, strengthening muscles that are weak, stretching muscles that are tight, and doing the things. But the problem is, most people are looking for that shortcut. They get out of pain, they stop what they need to do, and then they go back to their normal sport or activity. And then, 1 week, 1 month, 1 year, 2 years, 10 years, whatever happens, the same problem comes back. Most people don't keep up with that corrective care, and that's where most people fail. So if you're looking to improve your health, really focus on that deficits and those problems that you're constantly struggling with. Focus a little bit on your stretching. Focus a little bit on your strength training. Focus a little bit on your mobility, and I can guarantee that you're probably going to see some significant increases in reduction in your injuries. Based off of everything I just said before, you're going to notice that most injuries are self-inflicted because we do not take breaks, we do not improve our posture, and we always skip over that corrective care all the time. So most injuries are self-inflicted and can be prevented on their own. So if you just understand that most injuries are a culmination of repetition over time, meaning repetitive injuries, that they hurt over time. If you kind of break that cycle and you kind of do some of the opposite things that you need to do to help yourself, then you can realize that your injuries can be prevented in a massive level, and you can actually avoid many of them in the beginning. The final thing is, we are all here to serve each other and learn from each other. The truth is that we all learn from each other. We're all interconnected, and I think during this point in time, when I'm recording this, we are still going through our pandemic. I think it's never been any more clear that human nature is interwoven within each other. This goes from anything from economies to the pandemic, to socialization, to mental, to physical, to other countries. We are all woven together, and we are all dependent, and we're all here to serve each other, learn from each other. Every single interaction that you have today, tomorrow, the next day, and for the rest of your life can be used as a learning experience to help you help yourself, and as a result of helping yourself, you can teach that lesson to someone else. So view everything as a learning experience, and view everything as a way to learn from other and be integrated with each other. So I'm going to leave you with one final bonus one, and I want you to kind of live your life this way. And I think there's no better way to live this way. It's to leave things better than you found it. It's always nice to come into a room and then when you leave it and you're kind of staying with a friend or something like that, and it's cleaner than when you came. Your car is cleaner than when you got it. It's always a good feeling to leave things better, and it's always a good habit to have, to try to do your best to leave things better than you found it. So it's a great way to live, and if you do that day in, day out, consistently, and some days are going to be harder than others, but if you do that, if you try to leave things better than you found it, I can pretty much guarantee that you're going to live a better, healthier, and more successful life. And I have found that with patients, that if we try to educate them better, despite having bad experiences, having bad chiropractors, having bad physical therapists, if you just try to do better than what you found them in or how you found them, then that's all you need to do. Just do the best you can every day, day in, day out, and try to leave things in a better state than which you found it in. And I think it's a great way to live your life. There's no better way. So these are some of the things that I've learned over the last 10 years of my life as a chiropractor, treating patients day in and day out. So thank you so much for tuning in. Thanks for watching this all the way through. I appreciate you, and I look forward for another 10 years. Have a great day.